Hello, I'm Catherine Calarco, and welcome to a conversation today with one of the thought leaders in the industry, Neil Picton. He is the head of workforce engagement and information at the NHS Newcastle hospitals. He is profoundly involved in transforming healthcare, both now being able to set a foundation for better healthcare and into the future by being able to transform healthcare and deliver greater outcomes for both individuals, patients, and the workers at the hospital. Welcome, Neil.
Yeah, thank you. My name is Neil Picton. I'm the head of workforce engagement and information. I work within the National Health Service in the UK, specifically for the Newcastle upon Tyne Hospital's NHS Foundation Trust. So we're an organisation an acute hospital that provide acute services and combined community services as well. We have over 14,000 employees. We have over £1 billion turnover, and we're one of the biggest teaching hospitals in the UK. So yeah, it's great to be here. Thank you.
I really look forward to hearing your story about your RPA journey and how have you been able to respond to the COVID pandemic?
Yeah, so the COVID-19 has obviously had a huge impact, specifically on the NHS, providing frontline care under increasingly difficult conditions. I think in reducing robotic process automation over 12 months ago has really helped us with our response to that, specifically from a reporting perspective. I think as we go on, I think we're entering a phase of immense transformation in just understanding just how automation, as well as other key technologies, can help us get through what is an incredibly difficult period of time. So, as I say, 12 months ago, we introduced RPA into the business, specifically to try and transform and streamline some of our transactional business processes. It's more important than ever that we are looking to release time back to patient care. I think more and more we are seeing our staff and our resources consumed by unnecessary and burdensome administrative tasks, and I think RPA holds the key to help release some of that time back to more value-adding activity, like caring for our patients, which is exactly what we're here to do.
Neil, that's incredible. You guys are doing so much with RPA. Can you tell us a little bit more about the vaccine bot and some of the outcomes that you've been able to achieve with RPA?
We recognised very quickly that the administrative time taken up by the flu vaccination process, especially around reporting and the handling of the admin side, was just taking too long, and it was taking up a lot of our clinicians' time, or vaccinators' time, and our admin teams within our occupational health department's time. We recognised through the introduction of an e-form that the vaccinators were completing every time they gave the flu vaccination to a staff member, that information was then fully structured and delivered to our robot, who could then populate our occupational health database. We were now able to deliver accurate electronic reporting via dashboards that were delivered and compiled by the robot. I think, as I say, that's been a huge game changer. And from our occupational health team perspective, it saved them, collectively thousands of hours as an overall end-to-end process. We have 14,000 staff here, as I mentioned earlier. I think the fact that we've been able to save up to 10 to 15 minutes per vaccination from end to end is huge testament to the power and the transformative power of RPA in action within a healthcare environment.
What lessons or insights would you share with other organizations to help them to realize the same benefit from deploying intelligent automation?
Yeah, it's a great question. And I think, we've learned some huge valuable lessons over the last 12 months as we kind of, go on that journey ourselves. I think one of the key learnings for us is just to understand where RPA is best applied to, where automation is best applied to, because it's not always the silver bullet. It doesn't fix bad processes. In fact, sometimes it's quite the opposite. Processes that are already streamlined and digitally enabled and digitally mature are the ones that lend itself best to automation and RPA. So I think there's got to be an understanding of when RPA is applied and at the right time. Because I think sometimes you can feel, and we've sometimes experience getting a little bit lost within processes that weren't originally designed or best suited to automation as a solution. So it's really important that you develop that understanding, you have the right people involved. I think I mentioned earlier as well, we've developed this really positive relationship between developing and having the in-house capabilities of developing e-forms, which deliver structured electronic data to our bots, because they love it that way. You know, it's seamless and it has zero variation. So it means we can deliver that information and release the time that we're looking to do. So I think from a user experience, don't forget that people are at the very heart of these processes. And I think sometimes that can be forgotten as well. This is not just an IT solution. This is a transformation tool that we can all get benefit from. You know, my role is not just around data and information, it's around staff experience and understanding the importance of enjoying your work and making that work that we do more human. And as I say, we have the overall mission statement of releasing that time to increase the time we have caring for our patients. So I think, you know, understanding some of those fundamentals has been a real journey for us, and I think, you know, we're happy to continue that journey by sharing our lessons and understanding with others across the wider NHS and across the health and social care platform. So we're looking forward to the next 6 months and 12 months ahead, and actually hardwiring RPA into our digital strategy locally, as well as wider across the NHS.
You know, I love the fact that you've been able to take these key lessons and be able to deploy them now, and also looking to be able to scale across to transform an industry to create better healthcare. So what are your future plans? What is next for you at NHS?
Yeah, it's another great question. It's about collaboration. It's about growth. It's about the growth of automation. We started small, but we've done it in a way which is scalable. Through, you know, we've implemented our RPA program on a centre of excellence model, and that carries with it great ambition and great potential to grow outside of our organisation and into other NHS organisations as well. We know we have a great deal of work to do to improve the patient experience and the patient journey across healthcare into social care and through integrated care systems, you know, regionally and nationally. We're looking to use technology and automation to do that. So RPA, I see, is playing a vital role in the wider strategy of the NHS. So collaboration is something that we're already involved with. You know, coming together, you know, virtually and meeting other trusts that are starting their RPA and automation journeys, and how can we help and how can we learn from them as well? Because, you know, we are still very much on our learning trajectory as well. So it's absolutely essential that we learn from each other and we support each other. You know, this isn't a time to get tribal over local progress. This is about reaching out and pulling others up alongside us to move forward into this space. And I think that's how we're going to really achieve true success within automation, is by helping each other achieve similar successes.
That is spectacular. You know, if no other industry needs it more right now than healthcare. And so these lessons are fantastic to be able to share and are inspiring to other organizations. Thank you so much, Neil, for the time today to share your story and be able to provide insights that enable others to move forward as well.